So the topic I've chosen, so my name is Loka Vendra, and I'm a freshman who goes to High School South, which is located in New Jersey. The topic I've chosen to research is the renewal necessity and the pursuit of lasting immunity for the influenza vaccine. So the influenza was first made its debut in 1918 and still remains a significant global health concern to this day because it causes around 290K to 650K deaths by itself annually worldwide. The objectives of my research were to find out why a universal vaccine for this virus doesn't exist as of now, and the strategies various institutes are implementing to develop a sustainable universal vaccine. Currently, there are multiple vaccine options open to the public, each differing in doses to achieve a different amount of effectiveness. There is an egg-based vaccine and a live attenuated nasal spray. These are the standard vaccines that people usually take, and they're recommended for people of ages 2 to 49. But for people over the age of 50, it's recommended they take different vaccines that have 3 times the dosage to protect them. And all these vaccines that already exist protect from 2 influenza A strains and 2 influenza B strains. However, traditional influenza vaccines primarily target strain-specific surface antigens and require annual updates every year. So even if a vaccine works this year, it probably won't work the next year because the virus is always changing. So to develop a universal vaccine, an approach scientists have experimented with is training the body to produce antibodies that will target antigens that don't change like most of the time. So one that they're targeting is hemagglutinin, the hemagglutinin protein, a protein that plays a crucial role in the infection process and is usually the most consistent between the strains. Although the head of the protein tends to change as the virus evolves, the stem of the protein evolves at a slow rate. So that's what they plan to target. And there's also substances called adjuvants that are added to vaccines to enhance the body's immune response to an antigen. For example, there's the MF59 that can prolong the duration of an immune response. So when I started my research, I had to build background, and I did this by reading through multiple sources and clinical trials. So a clinical trial I found using a research center used the first strategy I mentioned, and they developed the H1SSF vaccine to enter into a clinical trial. And this vaccine was prepared in the form of nanoparticles. And their hope was for this vaccine to produce antibodies to the stem of the hemagglutinin 1 protein. And the trial would house up to 50 participants, ages ranging from 18 to 70 years old. And the participants are either given a 20 microgram dose or 2 60 microgram doses. And boosters were given 16 weeks after the first dose. So after the trial was conducted, they figured out that this vaccine would be safe, and their hope is to use this prototype to further developments for the universal vaccine and to use this successful trial for that. So as the clinical trial was taken very well by the community and the vaccine exhibited a durable immune response, the hope is that the results of the prototype can be used to make future advancements. One of the limitations of my study was that a lot of the clinical trials I found focused mostly on safety versus efficacy. And of course, safety is really important. I think safety should be focused on after they're able to find a viable option for the vaccine. That's it.
Yeah, you want to share your experience with Gifted Gabber?
Yeah, so my experience with the Gifted Gabber program was definitely a positive one. and I'm really grateful to Professor Prahlad and Professor Virgil, who guided me through the whole process of drafting and writing this review. Professor Virgil always answered my questions like regarding how to write a review because I've never written one, and gave me a lot of tips on formatting and references. And Professor Prahlad's given me like a lot of feedback on my writing, so I can add and make corrections so my information's like accurate and as informative as possible.
Great job. Dr. Prahlad, question for Shloka.
Yeah, so once again, I want you to answer like, what will be the best way then to go for like universal vaccine that we cannot? Did you find anything in your research that may be fruitful in future?
Sorry. Like a lot of the clinical trials I found, they took like a vaccine and they gave the dose, like multiple doses, and they kept increasing doses to see how people would take it, but they didn't like test it over a prolonged period of time to see if it worked against like strains year after year. So I think that's something they should do.
Yeah, thanks and great job.
Thank you.
Excellent.